Hi, I'm Jerry Hesch with the Hesch Institute in Henderson, Nevada. This case is titled Chronic Low Back Pain with Sacroiliac Joint Dysfunction in a Hypermobile 21-year-old male, Part 1. And the Hesch Institute is a clinic in Henderson, Nevada, very close to Las Vegas, Nevada. We do consultation and treatment for complex joint pain throughout the body, including the sacroiliac joint. And we teach seminars and distance learning to hands-on clinicians. This is an interesting case. Robert is a 21-year-old male who has been in touch with me for several months and has had to cancel efforts at coming out previously simply because he wouldn't tolerate the plane ride. He was injured in March of 2012, so that was 2 years ago, and he hurt himself lifting weights. He's had multiple consultations and lots of treatment, which ultimated in an osteopathic physician suggesting that he might have what is called sacroiliac joint dysfunction. And I will review some of the clinicians that he's seen and some of the tests and treatment that he's had. He has seen a physiatrist, a physical therapist, 3 orthopedic physicians, separately orthopedic surgeons, and neurologist, rheumatologist, osteopath, pain medicine physician, and some of those physicians specialized in things like prolotherapy and such as orthopedic medicine practitioners, and he did receive extensive prolotherapy and also platelet-rich plasma injection. The prolotherapy was 8 times. He had radio frequency ablation and extensive physical therapy, chiropractic, acupuncture, and osteopathic manipulation, and corticosteroid injection into the L3-S1 area and into the SI joint and epidural area. He has had x-rays and MRI, bone scan, and nerve conduction test. So Robert came from Hawaii to see me, and I took a look at him, and I think it would be good to just introduce, and maybe you could give us a brief summary of your experience.
Oh, okay.
And I mean prior to coming here. Just give us a quick summary.
Should I go there?
Yeah, you can come in here and sit on the table if you like.
So I hurt myself deadlifting and doing other weightlifting 2 years ago, March 28, 2012. At first, everybody thought it was a disc issue, but after seeing like maybe 8 doctors, an osteopath in Hawaii told me that he thought it was my SI joint. So we did countless procedures and everything, but even after doing countless procedures, from radio frequency ablations to platelet-rich plasma, prolotherapy, regular injections, physical therapy, pretty much nothing worked. And so we looked for somebody that specialized in the sacrum and the pelvis area, and this place came up. That's why we came here.
So let's have you lie on your back with your head up here this time. And when I started to screen you, I started to focus onto your right knee, and then you mentioned that you do have knee pain. And what I found was that his right knee does not extend quite as much. Robert has hypermobility syndrome throughout. He's got a lot of foot mobility. He's got a lot of mobility throughout all of his joints. And you can see the hyperextension in the elbow and hyperextension in his finger and the end of his finger joint. It is hypermobility syndrome. His right knee, however, only hyperextends about 5 degrees, and his left knee freely goes 10 degrees or more. Okay? When I spring the tibia, it has easy, clear, accessory motion. When I come to the right, I can't take up the slack. I cannot induce passive spring there. And by appearance, the right femur appears to be posterior, and it behaves like it's posterior. So one of the goals of treatment will be to restore normative motion in this knee in the sagittal plane. In looking at his hip motion, He's got very good hip motion in all directions, but straight leg raising is limited to about 70 degrees. I know that the camera angle doesn't really show that, so you'll have to take my word for it. And the left hip comes up freely to 90 degrees. Okay? The pelvis is asymmetrical, and I prefer terminologies like lumbopelvic hip dysfunction. Are you able to bring the camera in a little bit closer and focus a little bit more on his pelvis? I don't know if the camera angle will show it or not, but there is a distinct asymmetry in which the right pelvis is lower, the right shelf on the ilium. When I induce passive movement through the pelvis and spring it on the left, there is good movement throughout that structure. When I attempt to do that on the right, the motion is taken up very quickly with me applying even more force, and I cannot create motion through that structure. It does move in other directions. I can spring it in side glide on either direction. Moving inferiorly, I can load it and I can spring it. But it has a distinct lack of rotation in this direction. And I actually call that a restriction throughout the whole pelvis. It does not necessarily involve one ilium moving on the sacrum, and that's a whole other conversation that we won't belabor today. Can I have you lie on your stomach, please?
Facing this way?
Head up there, please. On both sides, I can induce passive motion anteriorly, pushing on the ilium. I can push the ilium on the left inferiorly. On the right side, I'm not able to load it. I'm not able to get any inferior mobility. And that's congruent with the whole pelvis being oriented in such a way that the right side is more prominent anteriorly. He also has greater tone along the right SI ligaments. So if I find the PSIS and palpate across, the ligaments on the right are much harder, and when I try and indent them, it almost feels bony. And that is also true for the sacrotuberous ligament right here. It almost feels like bone, and there is no bone right there. Sacrotuberous ligament on the left is normative. He does have a little more tone over the left side of his sacrum. And would you get up on all fours, please? And sit back. Very good. So when he loads his spine, pelvis, and hips in full flexion, called child pose, and I test mobility on each quadrant of the sacrum, I can put movement through that structure, through his body. But when I come to the left lower quadrant, I cannot. He does have increased muscle tone throughout on the left side, and as we walk up the spine, we find an area of restriction up in the mid-thoracic spine, and I can create spring mobility here. At this segment, I can't. At this segment and segments above, I can. Also has some restriction of ribs, rib springing at ribs number 6 and 7 on the left, whereas the ribs above, below that spring freely, ribs above that spring freely. And we also looked at his whole posture and his whole structure, screened his shoulders, AC joints, first rib, and cervical spine. There is a hint of a mild restriction up in the upper cervical, which might be compensatory. The point that I'm trying to show is that when someone like Robert comes with a long history of low back pain and a diagnosis of possible sacroiliac joint dysfunction, you do have to consider other joints. And in this example, his knee is involved, his mid-thoracic spine is also involved. So we're going to treat all of those structures, not just focus on the diagnosis of sacroiliac joint dysfunction. So we'll stop filming here, and we'll go to work, and we will film a part 2 after we treat them. Thank you very much.